But let me ask you about the distance that you see between where you think we're going and the morbidity and mortality that lays before us, and the kinds of decisions that are being made now to loosen all the restrictions, to open up different types of businesses and places where Americans can congregate. How big a chasm is there between where you think we're going and those kinds of policy decisions?
It's huge. I mean, look, the picture that has been coming out of the White House for a number of weeks is that, don't worry, this will all be over in a couple of months. We'll be able to go back to bars and restaurants. The football stadiums are going to be open in the fall, and life will be back to normal. And I think it's become a little clearer to a lot of people, even people who see that not everything is rosy in Sweden, realizing that, maybe we're going to have to be a little more careful about this. But the truth is, we're not sure how many Americans got infected in the first wave, but the estimates I've seen are between 3 to 10% of the country. In a country of 330 million people, that means about 300 million of us are still vulnerable to the virus. And there's no scenario in which 300 million people can come running out onto the streets and beaches and hopping back onto the subways and going back into our offices and piling into, for the end of the basketball season or the baseball season, and not have this all start over again. And last time you saw it from the White House, we were on the trajectory up to somewhere between 1.6 and 2.2 million deaths. And we haven't lopped off very much of that whole equation and made those people immune. A tiny proportion of the country is immune now. So we'll go back on the same track again if we come out. And people have to realize that this is going to be a slow, careful coming out, and we've got to watch. When Tony Fauci uses the expression, the virus will tell us, he means if we have broad spread testing all over the country, an enormous number of tests every day, and those tests have to be rapid because you need results. And a study came out of Harvard today saying we're talking about 5 to 10 million tests per day we need in order to really have a good eyeball on the situation in the country. When we get there, we can watch those tests. And when the positives begin to go up, we can say, OK, time to socially distance a little more. Let's back off, not into a total lockdown, but into enough lockdown so that the curves, instead of going up, begin to go down again. It's a set of constantly flattening the curves. And, what it looks like on the epidemiological models is, we're no longer on that giant alpine spike up to 2 million deaths, but instead it's going to be sort of like a series of shark teeth. Some deaths, and then we go back into lockdown and the deaths come down. And then some deaths, and we go back into lockdown and it comes down. And this may continue until we have a vaccine or a prophylactic pill, which may take a while, 18 months minimum.
Let me ask a cynical question, I guess a non-rose-colored glasses question of you, given that scenario. I do not have faith in our governing capacity as a country, particularly at the federal level, but also in a lot of states, to think about us being able to ratchet social distancing measures up and down based on epidemiological imperatives. I just don't think that we're nimble enough and rational enough and science-based enough to do that as a country. And so I look around and I see the president insisting on opening things up, red state governors insisting on opening things up, and I can't imagine that they will ever ratchet things down again in the other direction because they'll see it as a political failure. If they do open things up and never ratchet things back down, what happens to that curve? Do we go back to the sort of alpine slope up to potentially millions dead?
I don't necessarily agree with you. I mean, I think a number of governors are very clued up on this. Andrew Cuomo being one of them, Gavin Newsom being another, Mike DeWine in Ohio being another. And they'll recognize it. The other governors are going to see a significant chunk of their voters die. And they will get the lesson. It may take a couple of waves of the pandemic, but they'll figure it out. And, there's an expression in the Army, sometimes to get the attention of a mule, you have to take a 2x4 to it. That's kind of what we're looking at here. It may take the deaths of some people for governors to realize that running out into the open is not safe. And I, hope that the populace will be more sensible about that. and the governors will realize who they're putting at risk. It's going to be their own people. But that's learning the hard way, and I suspect that's what's going to happen in some states.
It's terrible. I mean, I believe you, but that's terrible. And I feel like I have already been watching at a micro level. I've been watching medical associations, nurses associations, hospital associations tell governors, please don't do this. Please give us a stay-at-home order. Or like in the case of Nebraska, they're going to reopen this gigantic mall just outside Omaha. And the Nebraska Hospital Association has said to Governor Ricketts there, please, for the sake of the hospitals in this rural state, do not do this. And he's blown them off, and he's going to open that stuff up anyway. I'm really worried that the feedback loop here isn't working in terms of medical expertise.
Well, the Diamond Princess didn't work out as expected either. Sometimes, the epidemiological models on the Diamond Princess said that even if there was a couple of cases aboard, that if you locked the ship down, you'd have less than 64 cases by the time they emptied the ship a month later. They had 712. So something went badly wrong on that ship. We learned that there's a lot of super spreader events. We've learned, the pastor in Virginia who decided that, God will protect me. I'll be washed in the blood of Jesus, and that'll be protective. He died. He infected his wife. People learn lessons the hard way. We saw Chris Cuomo on CNN quarantining at home and doing it about as perfectly as you could. There he was in the basement, his own bathroom. Wife left the food at the top of the stairs. Kids didn't come down. And yet his wife ended up getting infected. This is how the virus teaches us lessons. And that's a lesson we've known in the 19th century, in the 18th century, in the 17th century. We sort of forgot it in the 20th century in the age of vaccines. But we're being reminded of it again with this virus because we don't have anything to stop it except basically common sense.